Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, clinical features of pyogenic liver abscess. So, in patient with pyogenic liver abscess, the main clinical features are most common presentation of pyogenic liver abscess is the fever, whereas most common liver function tests in pyogenic liver abscess is elevation of alkaline phosphatase is seen. On presentation, you will see that there is fever is seen with jaundice. The patient presents with fever. Jaundice is also seen in almost 25% of patients. With right upper quadrant pain is seen and also tenderness. There is right upper quadrant pain and tenderness is also seen in these patients. Okay, these patients, because it is pyogenic, the patients will have fever with abdominal pain and jaundice are also seen. So pyogenic liver abscess, actually the abscess is usually a single abscess and it involves the right lobe more commonly than the left lobe. There are certain features which are associated with poorer prognosis if these are associated. So that means if this pyogenic liver abscess is associated with malignancy, or if it is associated with jaundice, or if it is associated with deranged liver function tests or sepsis, in all these four conditions, this pyogenic liver abscess has a poor prognosis. Then, diagnosis of pyogenic liver abscess. Diagnosis of pyogenic liver abscess is mainly made by ultrasonography and CT scan are the main diagnostic modalities of um, pyogenic liver abscess. Okay, but for confirmation of diagnosis is by you will have to do an aspiration of the abscess and culture it. On the culture you can find the exact microorganism which is responsible for the pyogenic liver abscess. You can do a chest x-ray also. If you do a chest x-ray, because there is a liver abscess present in the liver, so this liver abscess will shift the diaphragm above, resulting in hemidiaphragm. This There can be fluid exudating from the abscess through the small micropores in the diaphragm. They can reach the pleural cavity, resulting in right-sided pleural effusion. Then the treatment of pyogenic liver abscess. In the treatment, obviously the treatment of choice is you have to do the drainage of the abscess. We should do a percutaneous catheter drainage of the abscess is done along with intravenous antibiotics is the treatment of choice. First, these IV antibiotics are given for 2 weeks. So we give parenteral antibiotics or oral antibiotics are given for 2 weeks, followed by you will have to shift the patient to oral agents and they should be given for 4 more weeks. So first you give it for 2 weeks, that to parenteral antibiotics, then you should give oral antibiotics for 4 more weeks.
thank you and thank you for watching.